You're watching this video today because you are having surgery or a procedure that requires anesthesia services. Hi, I'm Dr. Todd Smith. I'm the Director of Anesthesia at Eisenhower Health. I want to talk to you today about options and risk and benefits of different types of anesthesia for your upcoming surgery that you're going to have. Before your surgery or procedure, you will undergo a preoperative evaluation that will be conducted in our pre-anesthesia clinic. This will involve pre-anesthesia testing, such as lab, EKG, may involve a physical examination as well. You will have a review of your medications, your health history, and any allergies that you may have. Depending upon the type of surgery that you're having, you may have one of three types of anesthesia. The first would be general anesthesia. The next option would be monitored anesthesia care, also known as MAC, or deep sedation. And the third type would be a regional anesthesia, which should include spinal anesthesia, epidural anesthesia, or peripheral nerve block anesthesia. And these are often themselves combined with a type of MAC or local anesthesia plus sedation. Your doctor may recommend that you have general anesthesia, oftentimes for surgeries that take a long time, or for surgeries that may have you in a position that may otherwise be uncomfortable. General anesthesia is often used in surgeries that involve the head, the chest, and the abdomen. There are two types of general anesthesia. The first is intravenous anesthesia, and the second is gas anesthesia. The first, intravenous, is a form of anesthesia that goes through an IV, and the gas form of anesthesia goes through a breathing tube or a simple mask. The type used depends upon the surgery. Monitors will be placed on your body to monitor vital signs such as heart rate, oxygen level, and blood pressure. You will begin general anesthesia by receiving medications through an intravenous line or breathing anesthetic gases through a mask or a breathing tube. You will be in a state of deep sleep to keep you from feeling pain during surgery. A BIS monitor may be used to monitor your level of consciousness while you are under general anesthesia. During the procedure, the anesthesiologist is continually present and monitors your vital signs to make sure they are normal and steady. The anesthesiologist administers and regulates the anesthetic to ensure your pain is completely controlled during your surgery. And now we're going to talk about potential risks and complications with general anesthesia. It is important to know that all procedures have some risk. Your overall risk for anesthesia really depends upon your overall health. The most common risk of general anesthesia are sore throat, nausea or vomiting, hoarseness, and dizziness, and there is a small risk that damage to your teeth can occur when placing the breathing tube. So it's important to let the anesthesiologist know if you have any loose teeth or dentures. Rare but significant side effects and or complications of general anesthesia can include allergic reaction, aspiration, awareness and or pain during the procedure, infection, breathing problems, injury to blood vessels, also irregular heartbeat, potential cardiac arrest, or loss of limb or life. Again, these side effects and complications are rare, and your anesthesiologist will be there with you during the entire procedure and monitoring your condition the entire time. After your surgery or procedure, you will be taken to recovery, and during that time, the anesthesiologist will monitor you while the effects of the anesthetic continue to wear off. The recovery nurse will check your activity level, breathing, circulation, and level of consciousness. The anesthesiologist is available to help control any postoperative pain and or nausea. The effects of general anesthesia may last up to 24 to 48 hours after surgery, and therefore you should refrain from major decision-making, signing important documents, and performing activities that require skill such as driving a vehicle and athletic events. You will need to arrange for somebody to drive you home afterwards. Depending upon your procedure, your doctor may recommend monitored anesthesia care. Monitored anesthesia care is also known as mild or moderate sedation. This may be used in conjunction with regional anesthesia or spinal anesthesia to lower your awareness during your surgery or procedure. An anesthesiologist gives you medications to relax you called sedatives through an IV line. A local anesthetic may also be injected into the skin and muscle around the surgical site to decrease sensation and keep you from feeling pain during surgery. You may feel drowsy during the surgery with monitored anesthesia care. The effects of regional anesthesia and monitored anesthesia care may last 8 to 24 hours or more after the procedure, depending on the type and amount of anesthesia used. One of the main benefits of having monitored anesthesia care is that you are much less likely to have a dental injury, which is a potential with general anesthesia. There are some risks with monitored anesthesia care, which can include breathing problems, nausea and vomiting, and even headache. The primary difference between general anesthesia and MAC is that you don't need a breathing tube with MAC or monitored anesthesia care, and so you have a little bit less of the potential side effects of general anesthesia when you have monitored anesthesia care. Depending upon your procedure, your doctor may recommend regional anesthesia. Regional anesthesia does not put you to sleep, but is commonly used with general anesthesia and monitored anesthesia care. With regional anesthesia, the anesthesiologist blocks sensation in a specific area of your body by injecting local anesthetic near the major nerves surrounding the area of surgery to keep you comfortable and pain-free. Regional anesthesia is often used for surgery on the arms, leg, and abdomen. With regional anesthesia, the decreased sensation effect may last for several hours after a surgical procedure, depending upon the type and the amount of anesthesia used. There are several types of regional anesthesia. Depending upon your type of procedure, your anesthesiologist may use one of these different types. Spinal anesthesia is a local anesthetic that is injected directly into the fluid surrounding the spinal cord in the back and is most commonly used for hip and knee replacement surgery. Epidural anesthesia is where local anesthetic is injected directly into the epidural space and is used most commonly in childbirth and labor. With spinal and epidural anesthesia, the most common risks and complications include changes in heart rate or blood pressure, headache or weakness, and sometimes difficulty urinating. Rare but significant risks and complications from both spinal and epidural anesthesia can include both short-term or long-term weakness from nerve damage happening during the procedure. Nerve block, which is local anesthetic that is injected near the major nerves surrounding the area of surgery. A peripheral nerve block may be used for both hip and knee surgeries to prolong pain control after surgery. Benefits, risks, and complications of peripheral nerve blocks will be discussed in a separate video. Opioid use is greatly reduced when you're using regional anesthesia, and that's a big driving force today to decrease the need for those kinds of medications and the potential side effects of opioids after surgery. In this video, we have covered both the risk and benefits of anesthesia. It is nearly impossible to go over every potential complication that you may have related to anesthesia, but we have tried to include the most common. You may still withdraw your consent for anesthesia up until the time that you have received medication for sedation prior to your surgery. If you have any questions about your anesthesia care, a board-certified anesthesiologist will be available to answer those questions either on the day of or prior to the day of your surgery or procedure. Thank you for choosing Eisenhower Health for your healthcare needs. We look forward to taking care of you.